Travel and Things, in association with Rugged Wear, Real People, Real Clothing, Real Solutions, presents In Conversation With. I'm your host, David Batsoffen, and today we are chatting with Ruth Ancer, who is a clinical psychologist in private practice. And Ruth has been chatting with me during the month of February about the various aspects of depression brought on by COVID. Ruth, welcome to you. Thanks for being back once again.
Pleasure, David. Thanks for having me.
Ruth, just a question that sort of stuck in my head this past week since we last spoke. Is the depression brought on by COVID similar to PTSD of some sort? And can it be treated the same?
I think that it has been experienced by many people as a trauma, but generally, when we're talking about PTSD, we're talking about heightened levels of anxiety induced by trauma. So I think that it has been a trauma, but I think I don't think it's PTSD in the classical sense.
Okay.
But I think that you're right in that a lot of difficult things have happened, and certainly where people have experienced loved ones or have had difficult experiences in hospital, that would have been traumatic.
Okay.
I think it was about a lot of very rapid change in the world and affected everybody.
Yeah.
Although the way that it affected people varied. So I do think that for many people, and perhaps maybe the loss of a job would have caused a kind of a trauma in someone's life, in that they suddenly didn't know in terms of income.
Okay.
Yeah.
So over the past 4 weeks that we've had in February, we've looked at various aspects of the depression, and you've covered things like grief and how people should be dealing with it. Are there any areas that you'd, in the final episode, like to highlight once again, where parents and children should be aware of things, how they interact with each other, how adults interact with each other, and maybe even those people who have been separated from loved ones because of COVID, how they can deal with the fact that they're not able to see a child or a parent because of lockdown, the various lockdowns and travel bans?
Well, I certainly think that what's vital is that people realize that it's okay to have emotional reactions to things, that are difficult, and that they're not alone. A lot of the time, I've seen people whose businesses have been destroyed by COVID, and despite the fact that it's been external factors, most of those people have taken it as a reflection on their personal failure. And we have to be aware that while taking personal responsibility for things is important, in these kind of instances, it's not helpful. Because if you're assuming that something didn't work because something was wrong with you, and not recognizing that economically the whole world was shaken by the pandemic, I think that gives you a distorted view of your abilities. So really important to be able to acknowledge what has happened, the impact that it had, and to be able to not feel ashamed or embarrassed if you have had depressive, or if you've had difficulties, psychological difficulties that you might not have had before or that have recurred. And I think that there was, even though we had an alcohol ban initially, there were greater instances of violence between people, so a lot of gender-based violence that increased. People were at home with sometimes abusive partners, and so there was a lot of things that happened as a result. So to be aware that the way that things have changed, it's not a reflection on your own, on yourself as a person who has failed because you haven't been able to kind of get a cum laude in the pandemic. So just the fact that we've survived and we are learning and adapting. But I think there've been a lot of changes. I mean, in terms of families being divided, not only physically, but also because of the issues that this has brought up. families divided because there are disagreements about vaccinations. That's very, very real. People who've unfriended people or had fights because they have differing viewpoints. And that has been very polarizing. So sometimes we don't look at what unites us, but we can look at what divides us. But I think we also have to look at how there have been some ways that we've come together, and there have been advances. We have things that can protect us, and being able to just acknowledge that we are all in this together, and we actually want the same things. We want a sense of normality. We don't want people to die, and that if we can all be more supportive and more compassionate to one another, and be able to, if you notice your friends, your children, your parents, that things are difficult or different for them, to be able to say, how have you been? How have you coped? What's happening? Opening conversations is really, really important.
I was just thinking while you were talking, we've all done that, wash your hands, wear a mask. I think the other one should be, if in doubt, reach out.
Yes, absolutely. Because I think for people, so many people who were alone during those first 5 weeks, or people who don't see people at work, I think reconnecting, if you obviously in person is fantastic. I always say outdoors, but seeing people, making connections, just checking on people.
Yeah.
Let this be a time for us to become kinder, more compassionate, more sensitive, and that will help. That will help enormously.
Ruth, thank you so very much for this series. I do hope that people take your advice, listen to it, use it in the way that they want to. And once again, it's been an absolute pleasure having you in conversation with. And I wish you all the very best. May you go from strength to strength. Stay healthy, stay well.
Thanks, David. You too.